A new study is linking physically demanding jobs now to a higher risk of dementia. The study, Hunt for 70 Plus, published by the Lancet Science Journal, studied over 7,000 participants between the ages of 33 to 65, all with jobs that require people to lift, climb, balance, walk, and stoop. So very active physical jobs. The study found those who worked in jobs like sales and retail, nursing, care assistants, crop farmers, and livestock producers, very specific, had a 15% higher chance of developing dementia compared to those who work in sedentary or office positions. Let's bring in Dr. Anthony Harris, Medical Director and CEO of HFit Health. Good morning. Good morning. What is the mind-body connection here for those in certain jobs?
Sure. Well, thank you first, Adrienne, for having me. And the mind-body connection here in this particular study is all about not just the physical activity, but likely the physical activity and the setting in which you're doing it, right? And so this study, which comes from a particular county in Norway, looked at individuals who at age 70 had one of two things, either dementia or what's called mild cognitive impairment, which is a form of kind of early dementia, if you would. Could be early Alzheimer's or other forms of dementia. And what's pivotal about this study is that it's how it was conducted. The data on how the individuals worked during their 30s and up until their 60s was categorized categorically by Norway and their system of looking at jobs. And so the data is a little bit more accurate than previous studies that have pointed towards physical activity, high physical activity, leading to higher risk for dementia.
But when you look at a study like this, I mean, many people who are in demanding jobs, they're not taking care of themselves. You know, whether you go to the workshop that your job supports for ergonomic information, they're not wearing the proper back supports, the proper shoes. They're not getting massages every week or every month or participating in fitness classes. But what should this study tell us about how we can prevent dementia?
Sure. So it's not so much how you're taking care of your body as opposed to how you're taking care of your mind during this physical activities. What this study and other studies have looked at is if you're under a lot of high demand physically and you don't have much alternative in terms of when you take breaks or when and how you do your job, if it's being very restrictive, if you would, in the job environment, that may be what leads to the kind of mental component that makes it worse for your cardiovascular system and the stress that your body undergoes, which may increase your risk for dementia. There's something called the physical activity paradox, and that is research has shown that physical activity can be beneficial for our brain yet and still, but it's leisure physical activity that's associated with benefits for our cardiovascular system and decreasing our risk for dementia later in life. And so, again, it's not so much how you physically take care of your body. It is important, but it's more important understanding how your brain is functioning and the stress that you're under as opposed to the actual job you're doing.
So if we were to take a solution away from this conversation, which thank you for breaking it down, that was brilliant, do we need to take more quiet times, more times of rest, more times to pause, especially if you have a physically demanding job?
Absolutely. You need to take more, we all need to take more time to pause, to have more leisurely physical activity, and to challenge our brain. If we look at some of the studies around this space, we can see that some of the jobs that are protective from a cognitive decline later in life are jobs that are challenging from a mental and cognitive capacity. And so don't be afraid to challenge your brain, or don't feel like you're out of gas completely before you get home and go to bed. Do a little bit each day, and that may go a long way to helping prevent dementia later in life.
Yeah, we are talking more and more about the neurological effects of our health or lack of health, and how that mind-body connection is so important. And thank you, Dr. Anthony Harris, for being with us. That was really cool.
My pleasure. Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.